Hello everyone, welcome to my channel. Today we are talking about one of the most powerful tools in lean healthcare, and not just in healthcare but in the lean world, the Gemba Walk. Have you ever wondered why some hospitals run like a clockwork while others always seem chaotic? Often the difference comes down to leader truly understanding what happens on the front lines. And in this video today, you learn the key 6 steps to a successful Gemba Walk, how to spot hidden waste like a detective, and a real life example from an ER where a simple observation can cut wait times by 15%. By the end of this video today, you'll see why going to the Gamba is not just a walk. It's the fastest way to fix what's broken in healthcare. All right, ready? Let's go. Healthcare is full of dedicated people, but too often systems get in the way of good care. That's where lean thinking can help, and why I'm so passionate about this work. I'm Mohammad Zaid Alam. My background might seem unusual for healthcare. I'm an industrial engineer and a Lean Six Sigma Master Black Belt with a 16 plus years of improving operations from factories to oil and gas industries. And now I'm applying the same efficiency principles to healthcare. What I've learned is this: the waste we tolerate in healthcare, delays, redundancies, unnecessary motion, is often identical to problems we have already solved in other industries. And my goal is to help bridge that gap. Because at the end of the day, better processes means less frustration for staff, better care for patients, and more value for every dollar spent. Let me start with something we have all experienced. How many times have you heard something from a colleague, a report, or even a news outlet, and it sounded right, so you believed it, only to later discover that when you saw it with your own eyes, the reality was completely different? That's where the concept of Gemba walks in. That's where the concept of Gamba comes in. Sorry. In lean thinking, Gamba means the real place where the actual work happens, where value is created. For us in healthcare, Gamba is the ward where the nurse is managing, say, 5 complex patients. Gamba could be the emergency room triage area during a surge where actually patients are waiting to be triaged. It could be the storeroom that is always running low on syringes at 3 p.m. It could be the handoffs between shifts where subtle communication gaps can affect patient safety. The idea originated in manufacturing at Toyota, where leaders were expected not to stay in offices or rely on, say, filtered reports, but to go to the shop floor and see the process in action. In healthcare, this matters more than ever. When leaders and managers go to the Gamba, they don't just see data, they see people, workflows, barriers, and brilliant workarounds. They hear the tone of a patient's voice or the stress in a nurse's expression. Gamba helps us make better decisions, spot problems before they escalate, and support our teams more effectively. And it's where the real improvement begins. So next time we hear something from a dashboard, meeting, or a conversation, let's ask ourselves, have I been to the Gamba? Have I seen it for myself? That simple shift can make all the difference. Now imagine this. You are in a meeting looking at a report that says patient flow in the emergency department is smooth, but something doesn't sit right. So you decide to walk down there, and what you see is a very different situation. There's a backlog of patients at the triage area, staff are stretched thin, equipment is misplaced. The report was not lying, it just was not showing the full story. That's exactly what Gamba Walk is, and why does it matter? It is a lean leadership practice where we step out of the boardroom and go to the actual place where the care happens, whether that's the ward, the lab, the storeroom, or the operating theater. It's not just about inspecting, it's about observing, listening, and engaging. We walk the floor not to micromanage, but to understand. We connect with staff, we see processes in action, and we spot opportunities to make things better, things we would never see from a spreadsheet. In short, a Gamba walk brings us closer to the work, the people, and the truth. So when we hear the word Gamba, it's easy to think it's just a manufacturing thing, something for factory floors or industrial engineers. But the truth is, Gamba is everywhere, no matter the industry. There's always a real place where value is created, where work truly happens. In healthcare, our Gamba is the hospital ward, the ER, the ICU, the pharmacy. It's where our patients are. It's where care decisions are made in real time. In manufacturing, it's the assembly line. In retail, it's the checkout counter. In logistics, it's the loading dock. Even in tech, like in IT industry, the Canva could be developer screen or a user testing lab. Whether it's a hotel kitchen, a classroom, or a teller station in a bank, Gamba is the front line. Remember, Gamba is the front line where the action happens. So why does this matter? Because the moment we realize that every industry has a Gamba, we stop managing from a distance. We start leading from where the real work and the real insight lives. This is not about copying other sectors. It's about adopting the mindset that says, to improve outcomes, I need to go where the action is. To improve outcomes, I need to go where the action is. Where the action is. That's the Gemba mindset, and it's universal. So this quote by Fujio Cho, former president of Toyota, captures the three foundational principles that defines an effective Gemba walk. Go see, don't guess, don't assume real work happens, whether it's a nurse navigating an overcrowded ER, a technician handling inventory delays, or a teacher dealing with classroom disruptions. Value is created where feet hit the floor, not where the reports are read. That's why the first important foundational principle of Gemba Walk is go see. The second is ask why. Improvement starts with curiosity, asking why, not just once, but repeatedly. Like a child asks number of times why this happened to understand. This is the way you need to keep on asking why, and it will help you uncover root causes instead of treating symptoms. This is the heart of problem solving culture. It's not about blame, it's about deep understanding. The third is show respect. This is the glue. Even when we challenge the process, we never challenge the person. Respect is listening without interrupting, learning without judging, and improving with people, not on people. Perhaps the most overlooked, yes, most powerful show respect means engaging with people as partners, valuing their expertise, listening without judgment, and acknowledging their day to day realities. It reinforces that continuous improvement only thrives in a culture of trust and dignity. So, as you see the footprints crossing the slide from the boardroom to the front line, remember that's the path every great leader takes. That's the Gamba mindset in motion. Let's now talk about why Gamba walks are especially important in the healthcare settings. At the top of the slide, we will see three key benefits of Gemba Walk. The first is connects leadership with frontline realities. Gemba Walk break down silos. When leaders go to where the work actually happens, they gain a direct understanding of the real issues staff face beyond what reports or dashboards can show. This fosters empathy and better decision making. The second is it builds trust and a culture of continuous improvement. When staff see leaders showing up consistently, asking questions respectfully, and listening actively, it sends out a strong message. What is that message? We care and we are here to help. We care and we are here to help. This builds psychological safety and nurtures a culture where improvements are welcome, not feared. The third is it enables faster problem identification and resolution. Seeing a problem firsthand often leads to quicker recognition and smarter real-time solutions. Rather than waiting for escalation or delayed data, leaders can act on issues early, often before they become larger systemic failures. So how does this walkthrough looks like in a healthcare context, right? So we will understand now in this further slide, how does it look like in a healthcare context? Let's imagine a hospital leader walking through the ER, ICU, or patient ward. Gemba walks start by physically going to care environments. This visibility ensures leaders are not detached from daily routines or daily realities. Second is observing how care is delivered. Leaders watch real-time workflows like medication administration, handovers, or patient transport, identifying both best practices and breakdowns. They observe how care is actually being delivered, looking for both good practices and pain points. Third is talking to nurses, doctors, technicians, and even patients. Conversations with frontline staff or patients give depth to observations. Leaders can hear directly what's working and what's not. Identifying bottlenecks, inefficiencies, or safety risk. From delays in discharge to cluttered supply rooms or communication gaps, Gemba walks uncover root causes, not just symptoms. Fifth is following up with actionable changes to improve care quality, safety, and workflows. Most importantly, insights from the walk must lead to action. Gamba is not just about observation, it's a catalyst for measurable and sustainable improvement. This slide outlines the 6 essential steps to effectively conduct a Gamba walk. Gemba walks are structured visits to the real place where work happens, aimed at understanding processes, engaging with people, and identifying opportunities for improvement. Let's walk through each step. The first is plan the walk. Start by selecting a specific area of focus, such as the ER, ICU, or a patient care unit. A well-defined scope helps ensure the walk remains purposeful and aligned with the improvement goals. The second is go see. Visit the area in person, observe the workflow and environment directly without jumping to conclusions. The goal is to see reality as it is, not as it's reported. The third is engage people. Talk to frontline staff, ask open-ended questions, and listen actively. Their insights are invaluable for understanding day-to-day challenges and uncovering hidden efficiencies. The fourth is show respect. Acknowledge the efforts of the team. Appreciating their work builds trust, encourages openness, and fosters a culture of continuous improvement. The fifth is take notes. Document key observations, obstacles, and ideas. These notes will form the foundation for future discussions and actions. The sixth and last is follow up. Act on the findings, share outcomes, implement improvements, and close the feedback loop to demonstrate that walk led to meaningful change. Okay, so we just talked about how to do a Gemba walk, going to the front lines, observing, asking questions. But here's the thing, if you don't know what you are actually looking for, it's just a walk. You'll miss the waste hiding in plain sight. Imagine this, you're observing a nurse and you see her walking back and forth between rooms searching for supplies. If you don't recognize that as a motion waste, you might just think, well, that's how it's always been done. But if you're trained to spot lean waste, you will ask, why is this happening? How much time is lost? How could we fix it? So waste in health business is not always something which is obvious. It's patients waiting too long. It's a waiting waste. Duplicate paperwork is over processing. Or even unused medication expiring, it's the inventory waste. If you don't name this waste, if you don't identify these waste, you cannot eliminate them. So before you do a Gemba walk, make sure your team understand the 8 types of those lean waste. Give them a checklist. And are we seeing delays, redundant steps, unnecessary movement. That's how you turn a routine walk into a real improvement. And remember, the goal is not just to see the waste, it is to ask why it's happening and then take action. Otherwise, it's just a walk. To understand the seven wastes in detail, you can watch my one video which was uploaded earlier. The name of the video is Lean Thinking in Healthcare Part 1, where actually I'm going in detail about each of the Lean 7 waste. So, all right, take a look at this timeline, patient in to patient out. You see these red blocks? Those are the non-value added steps. The green ones, that's where we are actually delivering care, where the patient gets real value. Now, here's the hard truth. Most of our processes are drowning in red in a healthcare, in a hospital. Delays, paperwork, waiting, rework, it's everywhere. And every second of that red, it's stealing time from patients and burning out our staff. This is exactly why we do Gemba walks, not to admire the green, but to hunt the red, to ask, why does this step exist? Does the patient actually care about this? How can we shrink this red block to kill it entirely? Because here's the goal. Every time we do a Gemba walk, we should be erasing red, not just tweaking it, but eliminating it. That's how we get faster, safer, and more patient focused. So next time you're on a walk, I want you to see this timeline in real life. Spot the rent, challenge it, and then let's get rid of it. So now let's see what a real Gemba walk looks like step by step. I have made this part of video so that after the theory, after understanding what walk is, we can actually see how does it look like in reality in a hospital environment, right? So for this second part, we'll follow Dr. Smith as he walks through the emergency department looking for what's really happening on the floor. I want you to pay attention to three things: where he goes, who he talks, to, what questions he asks. Because the magic is not in observing, it's in asking the right questions to uncover hidden problems. So, all right, ready? Let's walk with him with Dr. Smith. So let's begin at the beginning, because even before Dr. Smith puts on his walking shoes, he's got some important prep work to do. Now, just picture this. It's a Monday morning, and Dr. Smith is sitting at his desk with a troubling trend. The ED wait times have been creeping up for weeks. He could just guess why, but that's not how we solve problems around here. So instead, he decides to go see for himself. But here's the key: he doesn't just wander into the ED randomly. He's a strategic thinker. He's a strategic thinker, and he's thinking about it. And first he asks himself, what exactly do I need to understand? In this case, the question is, why are wait times increasing? Then he gets ready like a detective preparing for a case. He checks the data. Where are the worst delays happening? He picks his spots: triage area, nurse station, where the action happens. And crucially, he gives the team a heads up, because this is not a surprise inspection, it's a collaborative problem solving mission. That's the difference between a productive Gemba walk and just walking around. It starts with intention and preparation. Now the real work begins. Dr. Smith steps into the ED, but here's the important part. He's not there to talk, he's there to watch. Like a scientist observing nature, he stands back and lets the real story unfold. He plants himself where he can see the full picture, maybe near the triage desk, and then he watches. And what he sees: the nervous family stuck, waiting while their paperwork sits untouched, the nurse running back and forth looking for supplies, the doctor waiting impatiently for test results. And he's not judging. Dr. Smith is not judging. He is not interrupting. He's just absorbing the truth of how things actually work. not how they're supposed to work on paper. So he's seeing the real action, what is happening on the ground. And here's what separates a good observer from a great one. He's not just seeing problems, he's timing them. That quick triage process, it takes 8 minutes longer than it should. Those small delays, they add up to hours of wasted time by the end of the day. After watching quietly, Dr. Smith knows now it's time for the most important part, talking to the real experts, not the administrators, not the reports, the frontline staff who live these challenges every single shift. He approaches Nurse Jackson during a rare quiet moment and asks just one powerful question. Tell me what's the hardest part of your shift? And here's where the magic happens. Nurse Jackson doesn't hesitate and she says, we lose so much time waiting for lab results. By the time they come back, you're already behind. Bingo. In one sentence, she pinpointed a delay that reports might never show. This is the heart of a true Gemba walk, asking simple, open ended questions that uncover real pain points. Listening, really listening without interrupting or defending. Trusting that the people doing the work know the problems best. Because here's the truth, the solutions are already in this room. We just need to ask the right questions and then listen. Now, here's where many well intentioned leaders stumble. Dr. Smith has uncovered some hard truths, but this is not about pointing fingers. Watch, what he does next. He looks Nurse Jackson in the eye and says two simple but powerful things. Thank you for sharing that with me. I know it's not easy. You and your team are doing incredible work in tough conditions. This is not just politeness, it's strategic because that gratitude makes it safe to keep telling the truth. That recognition fuels their willingness to help solve these problems. That respect turns observers into partners. The golden rule of Gemba Walk. You know what? The second you make it about blame, you lose the opportunity to improve. Dr. Smith knows you can't fix processes by breaking trust. Now, here's where Dr. Smith does something that might seem small but makes all the differences. As he listens, you'll notice him jotting things down, not secretly, but openly, where everyone can see. And just watch how he does it. When Nurse Jackson mentions the lab delays, he writes down the note, lab result wait time 22-minute average. When he spots three staff members searching for the specimen, he takes a quick phone photo. And of course, after asking permission from the people, this is not about creating a list of complaints. You need to understand it's about showing staff the input matters enough to be recorded. It's about capturing the raw facts before memory, fades. It's building an undeniable case for change that no report can argue with. And notice he's not writing solutions yet, just facts. Because good observations start with seeing reality clearly, no filters, no interpretations. Here's where most Gemba walk fails, but not Dr. Smith's, because the walk is not the finish line, it's just the starting gun. 1 week later, Dr. Smith is back in the ED, but this time he's not observing. He's holding a printout of the notes we just saw, and he's gathered the team to say three crucial things. Here's what I saw and heard from you all. And he's sharing the raw observations. These are the pain points we need to tackle first. Now he's trying to prioritize those. And he's asking, how should we fix these together? That shows a nature of collaboration. And what happens next? That lab delay, now to address that, they implemented a new notification system. And there was an observation about missing supplies. So they create a standardized storage area. And most importantly, the team owns these solutions because they helped build them. This is the secret sauce. Gemba Walk does not end the door. It only works when you bring what you learned back to the floor. as an action. Now, here's the payoff. 1 month later, that number that started this whole journey, 80 weight times, it drops 15%. But the real story and the real victory is not on this chart. It's in the small movements you don't see. The nurse who now has time to comfort scared patients, the doctor who is not wasting energy hunting for supplies, the families who spend less time in limbo. This is what happens when we go see with purpose, ask with curiosity, listen with judgment, act with urgency. And Dr. Smith did not solve this from his office. He solved it where work actually happens on the Gemba. And that's the invitation for all of us to stop guessing and start seeing. And that's a wrap. Thank you so much for joining me on this journey through Gemba Walk. I hope this gave you some practical ideas you can take back to your own teams in work environment. And if you found this useful, hit the subscribe button so you don't miss our next video. We'll be diving deeper into lean healthcare, think mistake proofing, and cutting clinical wait times through implementation of many lean related tools and practices. Drop a comment below. I'd love to hear your biggest aha, moment from this video and what lean topic we should cover next. Remember, the best improvements start with going to see. Now let's get out there and make healthcare better, one Gamba walk at a time. Thank you.